Hello folks, this is Dr. Israr Khankhel. Um, Today I want to talk about obesity, of course, but I'm going to go over the medications very briefly, and I'm not going to talk about the medications in detail, but actually today what I wanted to accomplish in this talk is to discuss when one should consider the weight loss medications. And weight loss is a journey, and there are so many different steps. But what we want to do is that there's a few things that I wanted to talk about. The first one is that when should you consider the weight loss medications? Now, certainly there are a few conditions that need to be kept in mind before the weight loss medications to be considered, such as phentermine, Ozempic, Saxenda, Wegovy, Mounjaro, the new one. All these medications, it has its own role and it has its own place. So what are some of the things to consider before you go to your doctor and say, Doc, I think I need my weight loss medications? So the first thing is that you wanted to exhaust the natural avenues, which is to say, you wanted to start with the diet and lifestyle modifications first. And what I mean by that is that if your diet is not very healthy, if you're not doing much physical activity wise, if you have cravings and triggers that you cannot address those. So these are some of the lifestyle that we could change. So the general consensus are, before we start the weight loss medications, first we want to give a try from 3 months to 6 months of lifestyle modifications. And in these 3 months or 6 months time, we talk about some dietary changes, some physical activity changes, and some other mind reset therapies. And if we could not use a reasonable amount of weight, which is at least 5% weight loss, if we could not lose at least 5% weight in 3 to 6 months, say, and I think that will be the time, to consider to be evaluated for the weight loss medications. Now, the other things to consider for the weight loss is certainly you have to have a diagnosis of obesity. And the obesity, as we talked about in the previous videos, the obesity diagnosis is either a BMI of more than 30, or if you have a BMI of more than 25, but you have any comorbid conditions such as sleep apnea, uncontrolled diabetes, hypertension, and if you have these comorbidities, then you might qualify to add the medications to your other lifestyle modifications. So, in the nutshell, you have to have a BMI of more than 30 or a BMI of 25 to 29.9, which will basically qualify you for a diagnosis of obesity. And then certainly you can sit down with your provider, such as weight loss specialist or your own primary care doctor, to be evaluated for these prescriptions, medications. Certainly the decision is not that simple to start you on medication. It's not just the BMI. There are so many other considerations also. For example, your healthcare provider want to make sure that you can safely start the weight loss medications, that you don't have any um, risk factors, that you're not on any medication that can interact with these weight loss medications, which is extremely important. Um, they also wanted to evaluate to make sure that you're not going to have any um, side effects, that you will be at high risk to develop some of the side effects. Um, so, if, again, to recap, if your diet and lifestyle modification fails, and if you have the diagnosis of obesity, or if you have diagnosis of overweight with medical problems, then there could be a consideration that you could be started on the weight loss medications. Now, once, let's say, you started on weight loss medications, how long, you should stay on the medications? Again, that will be a decision between you and your healthcare provider. But me, as a weight loss specialist, generally what we do in our weight loss center is that if we start you on the weight loss medications and you have not lost at least 5% of your body weight over a period of 3 months, that will imply that you have probably failed that medication regimen. So if you do not respond to the weight loss medication that is prescribed for you over a period of 3 months, then other options have to be explored. And the first option would be to see if we could change your medication to a different weight loss medication that will be maybe more suitable for you. It's if that is one option. The other option could be that if we can evaluate very clearly that probably is not the medications, or you are on some kind of medications that is interfering with your weight loss medications, and then you not being able to lose weight, then the other option would be there are some devices that could be considered, certainly, and not everybody is a candidate for those devices, but those are approved by the FDA. One of the devices, for example, the Planety, which is called actually devices, but those are like a gel capsules. They usually take 3 capsules, half an hour, 1 hour before the your meal, with plenty of water, 2 to 3 glasses of water, and that basically fill your stomach 50-60% for another 2-3 hours, and this way you eat less. The other devices that is not done that commonly is an intragastric balloon, that they insert a balloon. They could stay there for up to 3 months, 4 months, which basically occupies a part of your stomach, and this way you have your stomach has less capacity for more food. Well, those are just a few examples of the devices. I'm going to cover these devices and some of the bariatric surgeries and indications and complications in another video, though. So certainly I'm not implying that anybody who wants to be on the weight loss medication, they just go for it. It's a complex decision, and it should be based individually, and it should be individualized. All these weight loss medications, I just wanted to clarify something, that all they do, generally speaking, is that to suppress your appetite. And how they do that? Some of these medications, they slow down your stomach. So when you eat the food, it does not go down too fast, so you feel full. And some of these medications, they also, the act on the satiety center in the brain, and so you feel less hungry. in some instances, and some of these weight loss medications also increases the amount of insulin that is secreted after a meal. It also decreases the hormone called glucagon that is usually released from the liver, and by suppressing the glucagon hormone, it usually spill less carbs in the system. So these are some of the common facts about the weight loss medication. The last point that I wanted to make, which is very important, is that there is no crystal ball. There is no medication in the world that will just make you lose weight. If you take only the medications, and again, I talk to my patients a lot, if you use only the weight loss medication and you are with the impression that these weight loss medications will solve my problem and I'll start losing weight, is totally incorrect. If you use these medications together with the diet and lifestyle modifications, you will be successful. What these medications do is that it suppress your appetite and help you to accomplish your goals. For example, to consume less calories and also to be more motivated to do your physical activities. Certainly the side effects of these medications had to be taken into consideration also. And I hope that some of this information was helpful, and I will see you